The impact of the Public Health Act, 1875, for improving public health. It took time for the measures of the 1875 Public Health Act to take effect. Councils needed to raise the necessary money through taxes to carry out all the measures. There had been huge improvements in technology and engineering, but it still took time to find and employ engineers and to design and plan the projects needed. Building a complex system of sewers and water pipes took time and a lot of manual labor. The speed at which councils undertook improvements varied hugely across different towns and cities, and progress was not as quick as people had hoped. However, the compulsory employment of health and sanitary inspectors rapidly improved knowledge of conditions in towns and cities. The reports made by these inspectors were published. This led towns and cities to start competing with each other to see who could carry out the greatest or fastest changes. Gradually, towns and cities across the country did become cleaner, and the improvements in public health provision began to improve people's health. The average death rate per year between 1838 and 1880 had remained about the same. The rate dropped every year between 1880 and 1890, and then remained lower than before 1880. Average life expectancy had remained fairly static since 1820 in England and Wales, but it rose from 41 for men and 45 for women in 1871 to 49 for men and 52 for women in 1901. Cases of infectious diseases such as cholera and typhoid decreased rapidly. There were no more outbreaks of epidemics like these. The last major cholera outbreak in Britain was in 1866. However, although the Public Health Act did improve public health by 1905, many people, especially the poor, still suffered from disease and poor health.